Okay, as I told you, I'm really, really first-timer, so please bear with me. Okay, the next talk we have is diabetes is a serious disease associated with high blood sugar, but how much do we really know about this condition? In fighting diabetes, a simple matter of just avoiding sugar? I don't think so, right? Today, Dr. Ng answers all the questions you might have on diabetes, including the underlying problem and common misconceptions associated with this condition. And a little brief into Dr. Ng bio. Dr. Ng is currently practicing in Mount Elizabeth Novena Specialist Center. His medical expertise encompasses a wide range of endocrinological problems, including diabetes mellitus, obesity, thyroid disorder, androgen, reproductive, adrenal, pituitary diseases. He also has a special interest in patients with diabetes mellitus, particularly in the early stages of glucose. I think he don't need me to, he wants me to shorten it. And let's put our hands together and welcome Dr. Ben Ng.
Thank you very much. Is this on? Great. There was a long talk just now. Who need toilet break? Who need coffee? Because I'm going to bore you all to death with another long lecture on diabetes. Anyone on toilet? No? Okay, let's do a few questions just to get us warmed up a little bit. I think, look, diabetes, who has diabetes or who knows a family member with diabetes? Anyone? Yeah, very, very common, isn't it? And in the last NDR, not this year, not last year, everyone PM, you heard talk, hey, diabetes, war against diabetes. We must reduce diabetes now, you know. So you go outside, you see a poster, HPB, let's beat diabetes. Together we can beat diabetes. It's true, isn't it? Diabetes is a problem. And I think a lot of us have family members and all with it. But the first question to ask, what is diabetes? If it's so simple, oh, high sugar, I cut down my sugar, all my sugar good already. That's all settled already, right? No need to, why should I be here? Correct? No, let's all cut down sugar. It's a good thing to do, isn't it? But is that it? What is diabetes? Many people go, if you go anywhere to market, people say, oh, I got diabetes. Then everybody got advice for you. You eat this, very good for you. No, you don't do this, very good for you. True or not? Everybody has an idea. What is true? What is not? In order to understand that, we have to understand what is diabetes? What is the problem in diabetes? And once we do that, then you can say, hey, that one I don't think correct. Hey, that one's correct. True. And what I want to do is address some of the myths in diabetes. And hopefully today, we can learn a little bit more about the condition. So, follow-on question. Who thinks diabetes is a sugar problem? Who thinks diabetes is a sugar problem? Nobody. I don't think I need to give talk. Everybody know already. You're right. Diabetes is not a sugar problem. And I'm going to learn two things. Beginning, I give conclusion now. What is diabetes? Diabetes is metabolic dysfunction. Metabolic dysfunction. These two words. If you want to learn what happened today, I saw this diabetes talk, this bald doctor was talking, I don't know what he's saying. One thing, remember this. Metabolic dysfunction. Remember that. That's conclusion. Let's go on. So this is where I work. I work in Mount Novena. During my spare time, I work for the university as well. And that's it. So the order of the talk today, what do I want to talk about? Every talk you must begin by introducing diabetes. So I'll go very quickly. The burden of diabetes, I think we know the problem here. I'll just run through it very briefly. Then more importantly, I want to spend a bit of time. You may have heard these myths and beliefs before. In fact, later when there are questions, if you have any beliefs that you want me to clarify, I'll be delighted to do that. But the common myths, first one, diabetes happen in older people. I won't like to define older people. We just had a dementia talk. But older people. Diabetes is sugar problem. So we cut down sugar only. If I cut down all my sugar, then I cure already. I don't have diabetes anymore. I developed diabetes because I've been very bad. I've been eating too much sugar. That's why I got diabetes. If I start medicine, for diabetes is forever. This is the biggest fear a lot of people have. Doctor, I don't want medicine because I start forever already. So, and finally I'll summarize. So it's very important to see the whole picture. I don't think there's any point, again, in saying that, oh, diabetes, high sugar, then I cut down sugar and it's going to be fine. You see this picture. You see this man very happy, he's waving at the camera, but if you don't see the whole problem, you don't see the main issue here. This guy's in big trouble, isn't it? But the first one, you think, he's doing okay, isn't it, at the end of the day? Correct? So let's find out what is diabetes. Diabetes is no stranger in our lives here, you know. You see Singapore, we're going to get 1 million diabetics, you know, by 2050. We are getting older, we are getting fatter, all this bad news we're having. We have the youngest numbers of diabetes in Asia. We are now going to declare war on diabetes, and the latest one, you know, 1 in 9 of us will have already has diabetes. The problem is very serious. We don't need to hear too much about this anymore, do we? But what is the problem? The diabetes burden at a glance is actually 1 in 3 problem. 1 in 3 of us are at risk of diabetes. So there's a good number of us here. 1 in 3 diabetics are undiagnosed. We do not even know we have diabetes. 1 in 3 diabetics have poor control. About 500,000 of us in 2014, 670,000 of us in 2030, and 1 million by 2050. Big problem, big problem. And why is it a problem? Basically, we know this, isn't it? Diabetes is the most common cause of blindness in the world. It is the most common cause that you are on dialysis or you go to kidney failure. It's the most common cause that you will lose a limb. The minute you have diabetes, statistically, you're 2 to 4 times higher risk of having stroke or heart disease. But the good news about this is that the complications of diabetes can be prevented. And we know this. How do we do it? We control the sugars, we control the risk factors, and things can get better. But it comes down to the question again, what are we exactly dealing with? How do we beat this? And just lowering your sugar is not the problem. So, first one. Diabetes occurs only in older people. Clearly, the way I say it is a myth, right? It doesn't occur in older people. It occurs in everyone. So this is very briefly, if you look at this graph, this is from the NHS in 2010. We should get the latest data again in the next couple of months. But if you look at the numbers, sorry for the busy slide, but if you look at it, you say, yeah, Dr. Ng, you're right. Well, you know, look at the, oh, this is not on. Yeah, if you look at the 60 to 69, 1/3 of us have diabetes. Well, yeah, it's more common, isn't it, in the older people? It is. However, if you start looking at the graph carefully, let me highlight to you that the younger people, the rate of increase is by far the highest. So it doesn't matter you're 20 years old, you're 30 years old. If you're 30 years old, 4 out of 100 people have diabetes. It's not a small number, and these people with 4 in 100 are going to have diabetes for the rest of your day. So for us of the younger vintage, it's not something, I won't get it, I only wait until 40 or 50. It's still possible that you can get affected by diabetes. So I think the first take-home message very quickly is diabetes can occur at any age, and again in Singapore, it's increasing in prevalence. 1 in 9 of us have diabetes now, and the lifetime risk is 1 in 3. Let's go to the more interesting part. Diabetes is a sugar problem. Clearly, it's not. Now, the best way to describe things is there are 2 kinds of diabetes. There's type 1 diabetes, which I'm not going to go on very much today. Basically, it's less than 5% of people with diabetes, and in these people, they have little or no insulin. So these are the people who, unfortunately, when they get diabetes, they go straight on insulin therapy. This is not what PM is talking about. This is not what the Ministry of Health is interested in. It's a condition which does need to be treated, but we will not be covering this today. What we're interested in is type 2 diabetes, and this is more than 95% cases of diabetes, and the magic word here, all these patients have metabolic dysfunction. Metabolic dysfunction. What's metabolic dysfunction? It's all about energy. If you really start looking at it, you know, what is sugar? When you go out before lunch and dinner tonight, you eat noodles, you go eat rice. What is it? It's sugar. Carbohydrates is a form of sugar. And what do? We use that sugar as a form of energy to help our hearts beat, to generate heat, to walk around. We are essentially machines. We use the food, and we use that as energy. So when you say, doctor, look, my sugar high, what has happened? Have you eaten too much sugar? No. If you are very young, you're 16 years old, you eat 3 tubs of ice cream, the sugar is going to be normal, isn't it? What has happened? When you eat that sugar, it's in the blood because it's stuck. It cannot go inside. It cannot be absorbed. That is the problem. You did not eat too much sugar. Your body cannot use that sugar. And because of that sugar in the blood, that causes damage. There's a big difference. Your body cannot use energy properly. It's not a sugar problem. So when you look at energy metabolism, the best way I give an example is when you're young, you're this fancy car, you know. When you're older, you're a more classical vehicle, and you're even older, you're there. And unfortunately, that's the severe dementia and the better, slightly older vintage. But what happens? So when we are in a brand new car, we are young and strapping and all that, you put petrol inside, what happens to the car? Very fast, isn't it? Very sporty. Then you put petrol in this car, and then it doesn't go so well. And then you put petrol in this car, then it has a big problem, isn't it? It doesn't even get out of the screen. Why? Because our ability to use energy goes down. The car is the same thing. You put petrol, but it's getting older and older, and the car cannot work so well. So in this car, it's inefficient. You know, it uses a lot of petrol. The energy doesn't distribute properly. Engine is overheating, wear and tear, you know, and that's what happens in a car. Bring that analogy to humans. You know, this young man, you know, who looks very young. I wish I had hair like him. But anyway, the thing is, you look at him, he's so good. He's very fit. He's running around. He takes energy, and clearly, he uses energy very efficiently. He uses all the energy is used up. He does very well. Versus the old guy who eats, he can run, but he cannot run so fast. He doesn't use the energy so well. So in a car, what we have is inefficient energy usage. You have engine overheat. You have wear and tear. In a human, you have diabetes, you have high cholesterol, you have hypertension, you have arthritis, you have wear and tear. So when you look at someone with diabetes, oh, doctor, I got diabetes, my high blood sugar, you are seeing such a small part of it. You are looking at high sugar, oh, high sugar, cut down the sugar, cut down the sugar. But what you don't see, what has caused that high sugar. And right below that, for anyone with diabetes, high blood pressure, high cholesterol. You may say, doctor, I got diabetes, but doctor say my cholesterol normal. I can tell you now, before you got diabetes, your cholesterol is lower. Why? Because cholesterol is a form of, it's a metabolite, it's energy. You can't use energy properly. Why are people with diabetes more prone to heart disease? Why are they more prone to cancer, osteoporosis, and so forth? Because they cannot use energy properly. They are inefficient. And you're inefficient, there's more inflammation. And that essentially is diabetes. It's not a sugar problem. It's metabolic dysfunction. Right? So take-home message 2, diabetes is a lot more than blood sugars. It's metabolic dysfunction. High sugars in diabetes represent a problem with the body being unable to cope with energy. It's not a sugar problem. It's a representation of many, many problems. So you should know the answer by now, isn't it? So if I cut down my sugar, I can cure my diabetes. Clearly, you know that's not going to be the case. You can get your sugars down. I've developed diabetes because I've eaten too much sugar. Let's talk strategy here. I think the treatment target for diabetes per se, I'm not saying it's wrong, should not be just, oh, I got high sugar, I just avoid sugar. I think it's good to avoid sugar because your body cannot cope with it. But rather than looking at the sugar and cutting down sugar alone, what we should look at is why my body cannot use sugar or energy properly. Why can my body not use energy properly? That is the question you should ask, rather than just, I cannot take sugar just to need sugar. That's why I say, I cannot exercise, so don't exercise. That doesn't make sense. Okay? So what happens if we don't preserve our metabolic function? It's not only important to just say that, I cut down my sugar, but I need to maintain my sugar. You hear of this normal story of someone, oh, doctor said I got diabetes, but never mind, this year he tell me to eat less. So you eat less. Then 2-3 years, hey, how come the doctor said I need medicine? Then 2-3 years, I need more medicine, then I need to inject already, very bad already. If we don't know how to look after this, we don't know how to preserve the whole situation, then this is where the problem lies. So Think about it. If we don't preserve, if we don't learn how to preserve function, think about it. Our bodies are just like this little donkey here carrying this cart, Normally very happy, very little, no issues. But if you put more burden, you need to carry more, you need to do more things, you got to digest more energy, you got to put more energy in the system, this donkey gets more tired. Then you pump more, do more work, what's going to happen? Then you tell it to do even more work, it gets exhausted. And finally, death. Because your pancreas, your body produces, you cannot use energy properly, you're not training your body, basically it starts to fail. So the same is for the pancreas. The pancreas is the body producing insulin, beginning very young, very strong, Then you go, I'm going to use more, and you don't use it correctly, it gets tired, and finally the organ fails. So the treatment, the process, what I want to do today is to really look away from sugar alone to preservation, metabolic preservation. Look after it, keep your sugars. I can't promise you everything gets older in time, everything fails in the end. I can't help you with that. But what we can do is we can learn how to preserve this function as well as we can. So early intervention is very important. Like my colleague said before, even in dementia, we need to move in fast. Because at the end of the day, you start to understand this is not, I'm diabetic, I'm no diabetes. The ability to use energy or the inability to use energy gets worse in time. So if you jump, doctor, I cannot use energy properly now. All right, let's try and get it better now. Don't wait until everything broken already, doctor, I cannot do anything, then we cannot fix it, isn't it? So when you start to treat, this is the typical sugar levels you see, The normal progression of someone with diabetes, as you know, if from your friends or your colleagues or your loved one or even yourself, is that over time, sugars go higher. And this is normal progression if we don't do anything. And when I mean do anything, doesn't mean medication. I'm just talking about doing anything, which is lifestyle changement, medication, and so forth. This is a normal progression. Some people say, doctor, maybe I wait for a while, I try, but they don't try. They tell me they try, but they never try. Then, 3 years later, the sugar go, cham liao, sugar very high, panic, I better take medicine now, or I better cut down my food, or I do something lah. Then what happens is they improve for a while, but they get worse. Versus the person, all right, I have a problem. The sugar's not so good now. Let's do something about it. What you realize, and you intervene early. What you have is that the progression of sugar and the decline of sugar is much, much slower. Why? Because what is the strategy? And again, please don't say Dr. Ben said take medicine. I'm not saying take medicine. I'm saying take action. There's a big difference. Take action. Whether it's you, whether it's doctor, doesn't matter. Take action. Why? Because if you look at it, impact of a high blood sugar, sorry about the busy slide again, what happens is this is the time of diagnosis. Never mind. This is the time of diagnosis. So you have the x-axis here is the time of diagnosis. Why can't I get this on? Can you try and get this? Yeah. So what you have is that you have the time of, great, okay, sorry. You have the time of diagnosis here. And what you have is that the typical story, doctor, I don't care, my sugar go up. And this blue part here is the area where you're exposed to high sugar. And we know that high sugar is bad for you, isn't it? It causes damage. So when your high sugars are up here, it causes organ damage. So by the time, doctor, I don't care, my sugar's so high, I got problem already. Then you start to get it down. Well, what you cannot reverse is you can't reverse this blue part. Every time, it's all time of exposure. The longer you're exposed to high sugar, the longer and the greater the damage is. That one is irreversible. God gave you this organ only. You can't get a new one. So ultimately, what you need, the strategy for intervention in diabetes is this. You intervene early. The minute you get diabetes, all right, let's get on it. Let's get the sugars down. Let's improve the metabolic function. You intervene now. Intervene now, and you don't have the blue bar. There's no exposure to risk, but less exposure to risk, less exposure to complications, and you do a lot better. You don't wait for things to fail. When things are broken, it's very hard to fix. Okay? So, doctor, that's very nice, that's very interesting. How do I look after myself better? It's pretty logical, isn't it? If you think about your car analogy, you know, all these activities make you stronger. If for your car, what do? You give it good petrol. If you give it good petrol, then you give yourself good food, good diet. If you want your car to last longer, you service the car often, so you exercise more regularly. You don't want to overburden the car, that's why you control your weight. So although I'm saying the same things, the principle, the underlying principle, you understand why we need to do this. And it's also very important that the way you do it is very important, you know. Many of my patients say, David, look, Dr. Ben, look, I actually very good one. I need Monday to Saturday, I eat very healthy, you know. Only Sunday I eat buffet. And then you think about it very carefully. It's logical, isn't it? If I told you, Doctor, Ben, how do I get fitter? I said, every Monday to Saturday you don't exercise. Sunday you do marathon for me. Okay, that doesn't make sense. At least marathon you chuan, you'll stop and then everywhere starts to hurt. If your body is not producing much insulin throughout the day, then suddenly one time you have to do so much work, do you think you will last? Of course not. It's the way, sometimes the way you do things is as important as how you do it. People always say, Dr. Ben, I got diabetes, I cannot eat anything anymore. Rubbish, you can. What happens in diabetes? Diabetes, can you use sugar in diabetes? Yes. Can you use sugar well in diabetes? No. So what do? Dr. Ben, I need one time a day, or what's the problem? Then it's like not doing anything and you give yourself a huge sugar load at one time. That's not the right way, or your body already weak. Then you eat so much sugar at one time. How do you expect your body to cope? You're trying to, A, have good sugar results, and 2, maintain yourself as long as you can. You're trying to preserve metabolic function. So take-home message 3, reducing sugar in diabetes is only part of the problem. Diabetes is not a sugar problem, it's a problem with the body using sugar properly. Again, start early. Start early before things start to break down. Once they break down, we have a problem here. So I think it's equally important in diabetes to reduce sugar levels, because I think that's extremely important, but also preserve metabolic capacity. And preserving metabolic capacity, I hope I shared with you, is a lot more complex than that. It's not just cutting down sugar. The way you eat is just as important. Okay? So myth 5, when I start medication, is going to be forever. This is a very famous one. So when do I need to take medication? I think it's useful to say that if you need medication because your health risk is very high, your sugar very high, you got eye problem already, you got kidney problem, I think it's very hard to say, let's slow down, slowly reduce the sugar. We need to get down the sugar very fast. I tried everything here, doctor, but the sugar's still high. Then I suppose there's a time to consider medication. At this point of time, I got a lot of projects to do, I got deadline to do, I cannot do anything now. So what you may want to do is keep yourself safe. Your sugar is high now, you may succeed in 6 months, you may succeed in 12 months' time, but we need to keep you safe now. So let's keep the sugar down so you can take medication for a while, and as a temporary therapy in anticipation of successful lifestyle intervention. Again, this is saying the same thing. Dr. I will be very committed in 6 months, at the moment I cannot do anything. Then we give you medication now, you're successful, can you stop medication? Possibly. It's something for consideration. And again, the planning for timing, planning the intervention is very important. So back to the question, doctor, if I start medications, will it be forever? I ask the question back. It depends on you. If you are going to do same lifestyle, you're going to sit there and grow old, not only do you need medicine, in a few years' time, you're going to need more medicine, correct? Because if you're just going to get older, everything's going to get worse. So clearly, you're going to need more medicine because your body's ability to use sugar is going to get worse. However, if you say, no, doctor, where's the problem in my metabolism? Let me improve my metabolism. If I get better, if I get my insulin levels better, if I can get my body to use energy better, do I need the medication? No. Why does doctor give you medication if you don't need it? But it has to come from you. If you do nothing, don't expect diabetes to get better on its own. It's not. Whatever lifestyle you led or were leading has got you here. If you do the same lifestyle, don't expect it to get better. But if you change, and that is a discussion of how much you need to change, will you get better? Possibly. I've seen many patients stop their medications. I've seen many patients reduce their medications. But it's a constant work. The minute, wow, my sugar better, I go back and eat, it's all going to come back again. All right? So it really is a balance between action and inaction on the patient's part, and the role of medicines. Now, this is another one. Another one, a lot of patients tell me, hey, doctor, I read newspaper, this medicine very good. Or, hey, doctor, my neighbor used this medicine very good. I want to try also. See, there are 8 different diabetic medicines. All of them are lower your blood sugar. All of them lower your blood sugar. If not, you cannot get license for diabetic medicine. No. All of them lower your blood sugar. However, all of them do it in a different way. So the question that you should have is not, wow, this is my neighbor good, very good, I must try also. The question is not, doctor, I want this medicine, I want that medicine. These are all the medicines there. I'm not going to discuss about the medicines. This is not the question you need to ask. The question you need to talk to your doctor is that, what am I willing to do? So the first part, your perspective, the patient perspective. How much can I do? And it's perfectly fine, Please don't feel bad that I cannot do anything anymore. I have done the best I can. I cannot, I know everybody tell me to exercise more. I cannot already, I've got no time, or I'm not willing. There's no shame in that. You have to live. If you can change, please do. But if you can't, I cannot give anymore. That's fine. What kind of regime suits me? I need to take one a day, or some of the regime, my most famous one, I treat a lot of patients who do business. Every day I do 10-course dinner. I must eat, if not I got no business. Who am I to tell you don't do business? Correct? Do your business. Then your regime has to accept one very large meal a day. You must take medication to match that meal. You have to treat that meal. So do I need medication to supplement certain times? So that's perfectly fine. Look, even for those who don't have diabetes, sometimes you're fatter, sometimes you're thinner. Sometimes you're fitter, sometimes you're not so fit. That's life, isn't it? You don't expect diabetes, you take this medicine, same medicine, forever. You can do that. Someday you're going to be fatter, someday you're going to eat more, sometimes you're going to eat less. Sometimes, wow, these 6 months I'm very active, I'm going to do things. Why do you take the same medicines? If your lifestyle is not the same, you do not need the same medicines. You need to change according to the lifestyle that you want to lead. Once you get this settled, then only you should bring it to the doctor. Because the doctor cannot say, hey, take 2 tablets like this, everyone should be on these 2 tablets. Doesn't make sense. Once you say, doctor, this is what I need, this is what I want to do, this is my lifestyle, then only the doctor can say, oh, this patient wants to do this. So, must we be aggressive? How aggressive? What sugar targets? What do you expect from us? And maybe you got kidney problem, heart problem, and we need to address all this. So the real diabetes care model I find is very simple from the person in the gym. You're just lifting weights. The weights is the sugar. The patient is the one down here. The doctor is the one spotting you. The person who's lifting the weights decides how much can I weigh? How much do I need to push in? If I do more, then the doctor do less. How much? And sometimes, I'm very tired, you better help me up. Then the doctor has to do it. Then today I'm very fit, I want to do more. Doctor, do less. The first thing any person has to do, you have to decide, as a patient with diabetes, how much can you push in? Only then can the doctor know how much. Because both of you want the same thing. Everybody wants good sugar. Doctor also wants good sugar for you. You want good sugar. You want no complication. Doctor also wants no complication. But how much, you have to decide how much you want to give first. If you give everything, doctor need to do very little. You don't want to give anything, doctor will do a lot. And it's that constant relationship. That's why it's very important. Anyone with diabetes, have that relationship with your nurse, with your doctor, because things will change. Life will change. And that's important. Okay, so to finish up, eating natural products cure my diabetes. This is quite famous. Okay, so many people say, oh, doctor, I'm this bitter gourd. Can I eat bitter gourd or not? Can I eat cinnamon? Can I eat lady's finger? Can I drink green tea? Now, be interested to know that some of these things actually work. However, it's not as magical as you think. Lady's finger, the okra, right? Very sticky one, isn't it? Yeah. What it does is that because it's very sticky, it coats your gut, so you don't absorb sugar as well. Bitter gourd also very bitter, so it slows the progression of sugar down, so you don't absorb sugar so fast. So the thing, doctor, I love bitter gourd, then please eat more bitter gourd. But if you drink bitter gourd juice and you don't eat sugar, you're wasting your time. So the effects are more mechanical than you think. So if you like lady's finger, you eat lady's finger, you eat rice together, the sugar will be absorbed more slowly. It'll still be absorbed, but it'll absorb more slowly. So does it work? Well, I suppose to an extent, I've used bitter gourd and so forth. It slows the sugar absorption. Some green tea promotes some insulin release, but the effect is not so dramatic, I mean, for those who measure their sugars, it's about 0.3, 0.4 millimoles per liter, so it's not as if it's going to change the world around, but if you like it, it's no harm, It may be beneficial in the early stages. And I understand today's an MCT talk, so I just thought of just adding this in. Some people are taking coconut oil for sugar. So, I mean, to be fair, there's some evidence for it. There's a component, one of the oils in coconut called medium chain triglycerides, and some people have used it. And there's some data to actually show that it actually improves insulin sensitivity. Means the insulin that you use works a little bit better, and it just has some fat burning capacity. But again, I think the thing has to be, do I muscle? So I'm going to stop all my diabetic medicine, I'm going to take more coconut oil. I think that's clearly wrong. However, to add it on, to make it part of your diet, I don't think there's any harm to put most ladies' fingers to eat more bitter gourd, increase your chromium intake. I don't think it's wrong. However, I think that the full effects of it has yet to be established, and certainly, again, it's not wrong. So, final take-home message. How am I doing for time? We're doing okay. More than 80% of people with diabetes ultimately need medicines, but it's very important. It has to be tailor-made to your medical needs, to your needs, not just medical needs, but how much am I willing to give? Always ask first, before you see the doctor with diabetes, how much am I willing to give? If I'm willing to give a lot, then I might be able to do a lot. If you're not willing to do anything, or you cannot give that much, then you must be prepared to get more medication. Supplements and natural products to control sugars can be used, but the effects are mild. So to summarize, take-home message 1, diabetes occurs at any age. In Singapore, we have the highest prevalence of young people with diabetics. 1 in 9 Singaporeans have diabetes. The lifetime risk is 1 in 3. Diabetes is more than blood sugars. The magic word again, if you learn nothing, what is diabetes? Diabetes is metabolic dysfunction. High blood sugars in diabetes represent a problem with the body unable to cope with energy, not a sugar problem. Take-home message 3 is important to start early in the treatment of diabetes, and it's important to understand the reduction of blood sugars, but also to preserve metabolic function. Finally, more than 80% of people with diabetes will need medication, and you need to tailor-make it depending on your needs. So, to finish up, this is a quote of one of my patients who's not here anymore, but I think it's very, very important. When you ever come with chronic illness, with diabetes, with blood pressure, cholesterol, and so forth, you have to learn to live with the condition. I do not want to suffer from chronic disease. I want to learn to live with it. Diabetes should not be a situation. I got diabetes, I cannot eat sugar anymore. I cannot this anymore. And that makes you miserable, isn't it? If I told you cannot eat rice anymore, how does that feel? If I told you, if everybody said, oh, you're diabetic, you cannot eat cake, how does that feel? The reality is you can. However, know your limits. Learn to live with diabetes. You don't have to suffer from it. And that's it. Any questions?
Let's give Dr. Ben a round of applause first before he answers the questions. Okay, I think we're hooking up the Slido. I have seen many people using high-fat, low-carb diet to reverse diabetes. Is this safe and effective?
Can I come back for another talk? I think, again, we have to go back to the first statement of what diabetes is. Diabetes is a problem with sugar utilization. The important thing that we have to realize is that if you take the sugar away from your diabetes, from your diet, what happens? Your sugars will come down, correct? Your sugars will come down, which is good to an extent. However, I think, first of all, you have to realize the long-term effect of just high-fat diets and all that, not well established, especially when you start talking about the usage of saturated fats and all that. There's a potential risk of heart disease. I suppose if you start using more good fats and all that, it'd be better. But I think one thing is for certain, I think the general Singaporean diet has way too much carbohydrate. So I think for all of us, with or without diabetes today, a reduction in carbohydrate content is definitely useful.
Okay, next question. I heard someone told me too much juices are quite bad for diabetes. Is this true to just have more juice but not too much more fruits but not too much juices?
All these very good questions and very long answers. Yes, I think that the first thing, there are several principles in diet which I think you have to be aware of. The first thing about it is that, A, you must eat something. So what we call this replacement therapy. You can't just say, oh, doctor, I don't want sugar, I don't eat anything. You must eat something, okay? However, what you replace it with is important, number one. The second thing is that what I like to tell all my patients is the first principle when it comes down to food. Does it make you full? Getting full is important. So to answer the first part about juices, you can drink, if I squeeze 5 oranges for you, you still can eat your noodle, your rice and all that. I ask you to eat 5 orange, you won't eat anything else already. Correct? So I think the first statement is juices versus actual fruits itself. I think certainly take the fruit itself, there should not be that restriction. I cannot eat this fruit, I cannot eat that fruit. That's the first thing. Certainly avoid the juices if you can because they have high sugar concentration. Too much fruits, like everything, too much of everything is not good for you, true or not? So I would certainly reduce the amount of fruits, especially the sweet fruits that you have. But again, the first principle is avoid the juices first.
Okay, I read it. Does the reading 5.9 consider pre-diabetic?
No. I got a very long answer for that, but the answer 5.9.
We have the time.
Okay, good. The answer, no. But you have to understand again, diabetes, what is diabetes? Come on. What is diabetes? Metabolic dysfunction. Yeah, so there's no point in saying, wow, doctor, if you're, let's just say, I mean, for argument's sake, 6.6, 6.1 is pre-diabetes, you know. So this guy thought, wow, I got no pre-diabetes, let's go eat char kway teow now, you know, very good. I mean, the reality is this. There is no bar. I tell you the 6.1 came from a man, or woman if you're sexist, but somebody came up with this cutoff. What is diabetes? Somebody came out, you think so chun. The fellow with 5.9 and 6.1, right, who's at greater risk of heart disease and eye disease? You think about the same or very different? About the same one. It's about the same. So the question rather than saying, oh, 5.9, I got no diabetes, and you start, you know, or I got 6.1, oh, my life is not the same again now. You know, what you need to do is, what's wrong? What's the trend? And what's happening inside? Everybody has a sugar. Every sugar is matched with the insulin level. There's no point saying that diabetes, doctor, I got no diabetes, I'm so happy, if your body's overproducing insulin to keep it down. There are more assessments than this. Don't look at a number. This is not a number. We don't treat numbers. We treat individuals. We treat what's happening inside. So 5.9, I won't bring out the champagne. I'll think, what was my levels before? What is my lifestyle? And when am I going to do something? When I hit 6.5? When I hit 8? When I hit 12? When is it time to intervene? Intervene now.
Assume the patient is committed to lifestyle changes. Can he wean off medications? I think you've answered that, right?
Yeah, it depends. I mean, really depends on how much you're willing to give and depends from individual to individual.
Would a diabetic patient suffer from arm, shoulder pain, ache?
Yes.
It's
You can. I mean, you get greater risk of things like frozen shoulder and all that. And if your sugars are very high, you can get glossylation of the ligaments and all that. Basically, sugaring of the ligaments so they become very, very stiff. So yes, it's possible.
Why do a diabetic have fainting spell occasionally?
Many reasons. From the medications that cause the low blood sugar, so be very careful with that, to heart problems where you get low blood pressure, dehydration, multiple reasons, you know. So you still can get, you are at risk of it, but I think it's important to assess it. There are multiple reasons, so it's very hard for me to specify one particular thing.
It's an interesting question. Can drinking more water after sugary food dilute the sugar volume in your body? Oh, wow.
Yes. I mean, in simple answer, yes. What happens is that if you drink more water, I don't know how many of you speak Malay, there's something called kencing manis, which actually brings me a story where, you know, last time before we had those dipsticks, the doctors used to taste urine. Lucky I'm a doctor now and not many years ago. But that's how it happened. So basically what happened was the body doesn't like high sugar. It will try everything to bring it down. So what it does in the beginning is try to use its insulin. We produce insulin to bring the sugars down. However, if it doesn't succeed, we pass the sugar out via the urine. So if you drink water, you pass more urine out. So we do ask people with high sugars, drink more water. However, the question is, what are you trying to achieve here? You know, you want to eat more ice cream, so you drink a bit more water. I mean, at the end of the day, the question is that, go back to first principles. What is wrong? What is wrong is metabolic dysfunction, correct? You eat this, you want good score, don't see doctor. Okay? No need good score. You're helping who? Doctor or yourself. If no doctor is going to scold you. You want to make yourself better. If you drink more water, you get a better sugar result. The sugar load is still the same. You still tax your kidneys by passing the sugar out. So ultimately, you get a better score, but you're doing yourself no favors.
Okay, next one is interesting too. Must patient take medicine for pre-diabetes?
Depends on the problem. Again, I think you have to understand that there is no true definition. I mean, there's a medical definition of diabetes, but let's just say there's no true definition of metabolic dysfunction. Let's just say in pre-diabetes, there's a problem already. My personal thought is this. If you have pre-diabetes, let's just agree now there's something wrong. True, false. Something wrong, correct? If you do nothing, you think it will get better? No. So if I have pre-diabetes, I would probably do something. Whether it's to do lifestyle or medication, that's your choice. My personal thought with all of this is lifestyle. Please do something. I mean, your lifestyle is not good, not healthy, right? Try and change it. Try and get the metabolism better. But I do not do anything like doctor, I'm still going to eat that kind of thing. Then medication, I mean, this is something you need to consider, and it's a question you need to ask yourself.
And I think you probably answered this already. Can diabetes be reversed and be completely healed?
Depends. Everything is depends.
Depends,
yeah, depends. Depends on how much you're willing to do, and depends on how. I think we've talked about it in the beginning. It depends on what stage of diabetes. I think you've got had it for 10 years and all. It's going to be pretty tough. If you just got pre-diabetes, or you're going to develop at 5.9, for instance, then it's possible.
The 10 years thing now, okay?
Same thing. Yeah, I've actually answered the second question by mistake.
Is it likely that he will have it forever? I think you said the answer, right? Yeah.
More likely. Trying to cut rice intake will feel lack of energy. How should I resolve this? Very, very good question. A very, very long answer. I think that when it comes down to metabolism, you have to understand that the body uses many different forms, two main forms of energy. Is sugar and fat. So the first thing to understand is that everybody burns energy. So we heard of metabolic rate before, isn't it? So everybody has a metabolic rate. And out of this metabolic rate, there's a preference for sugar or fat burn. So if you are, for instance, sugar burn, means your body is burning and it only wants to use sugar, likes to use a lot of sugar, and then you don't have sugar anymore, then you feel very tired because your body's constantly looking for sugar. So what you need in a case like that is that don't burn so much sugar. You change your sugar burn to fat burning capacity. So your body aims to burn more fat, then you feel better. So that's some of the principles of a ketogenic diet and all that. So ultimately, it's a matter of what your body prefers to burn. If you like to burn fat, you cut down your rice, you don't feel any different.
I think let's do the last question.
Yep.
Sometimes at 6.5 mmol, I feel very hungry, but then once at 4.5, I don't feel hungry. What happened?
What has probably happened is that when your sugars go up, your body produces insulin to bring it down. There's a normal mechanism. In people in the early stages of diabetes or have pre-diabetes, or some, if you're younger, most commonly in young females and all that, you eat food, sugar starts to go up. But your sensor is a little bit jialat already. So what happens is that you overproduce insulin to bring it down. So what happens is that your sugars shoot down, and the bigger the sugar load, the more insulin you produce. So your sugars start to drop very quickly, and then you get very hungry.
Okay. I said that's the last question from Slido. Any question from the floor? Or, we take one question? If not, no questions from anybody? Okay, then let's give Dr. Ben a big round of applause. Dr. Ben is from Malfi, Ardent Endocrinology Specialist Clinic Private Limited. And, okay, thank you. I got something for you. We're gonna have a break now. Perhaps you all can go out to, for your tea break at this moment, and then come back at 3:30. Thank you.